Before we begin, I'm just going to do a 360 view of the room. Okay, perfect. So now I'm going to perform hand hygiene. I'm going to apply my gloves. I'm going to wipe my stethoscope. Perfect. So hi, my name is Mckayla. I'm a student nurse from Seneca College. I'm here to perform a head-to-toe assessment on you. Is that okay? Perfect. I'm just going to take a look at your wristband and just double check your name and your date of birth. So can you state your name and date of birth for me, please? Perfect. So everything matches. I'm just going to close this curtain for some privacy. Perfect. So age appears as stated age. Skin color is even, intact, and consistent with genetic background. Can you stand up for me? Good. So height is in normal range for age, and weight is within normal limits for height, and body build's good, and there's an even distribution of fat. Posture is good, and no obvious physical deformities. Patient's position is sitting comfortably and is erect in the chair. Patient is maintaining eye contact. Patient's mood appears happy, comfortable, and cooperative. Patient has clear and understanding speech. Patient is dressed appropriately for the weather, looks clean and groomed, and the clothes fit the body. For range of motion, can you flex your arms for me and extend your arms for me? Good. So range of motion is smooth, accurate, and coordinated. And then can you stand up for me, walk to the end of the room and back? Good, thank you. So your gait is smooth, even, well balanced with symmetrical arm swinging. Now for work of breathing, patient is breathing effortlessly and there are no signs of distress. Now for level of consciousness, the patient is alert and awake. For orientation, can you tell me your name? Perfect. And can you tell me where you are? And can you tell me the date? Perfect. So patient is alert and oriented times 3. Now I'm going to inspect your skull and your scalp, okay? So it's normal cephalic, round and symmetrical, no signs of any deformities, no lumps, no lesions. And while inspecting your hair, it's evenly distributed and there's no signs of any infestation. For your facial structure, it looks symmetrical, no involuntary movements. Do you feel any pain while I palpate? No. And there's no tenderness or swelling. Now I'm going to test cranial nerve number 7, okay? Can you smile for me? Now smile with your teeth. Frown. Raise your eyebrows. And shut your eyes tightly. And then puff out your cheeks. Perfect. So face has symmetry. Now I'm going to inspect your eyes, okay? So your sclera of your eyes is white. There's even lash distribution. And then can you open and close your eyes for me? Perfect. So there's no sign of any lid lag. Eyebrows are symmetrical. And the conjunctiva is pink in color. Now I'm going to test your cranial nerve number 3. So pupil size is 5 mm on either side. So pupils are equal on both sides and round. Now I'm going to test for direct and consensual light reflex by shining a light in your eye, okay? Good. Good. So eyes are constricted for both direct and consensual light reflex. Now I'm going to test for accommodation, okay? So can you look at the tip of my pen And I'm going to bring it towards you, okay? Perfect. So the eye's constricted. Now I'm going to inspect the ears, okay? So ears look symmetrical, equal bilaterally, and have no discharge. Now I'm going to palpate the auricle and the tragus, okay? For any tenderness. Did you feel any pain? There's no tenderness, okay? Now I'm going to perform the whisper test, okay? I'm going to say 3 words in each ear. You just repeat the words back to me, okay? Perfect. So now I'm going to inspect your nose and your sinus, okay? So nose is midline. There is no discharge. Now I'm going to palpate the frontal and the maxillary sinus, okay? So there's no pain or tenderness and only mild pressure. Now I'm going to inspect your mouth and your pharynx. So your lips are hydrated and there are no lesions. And can you open your mouth for me? So your gums look pink and there is no bleeding. Teeth are evenly distributed in position and there is no looseness, which is good. Now to check for your tongue. So can you put your tongue to the roof of your mouth for me? Perfect. So there's no signs of any atrophy or lesions. And hard and soft palate are intact with no lesions as well. Now I'm going to test for your cranial nerve number 9 and 10. Can you please say ah for me? Perfect. So uvula and soft palate moved up and back when saying ah. Now to test for cranial nerve number 12, hypoglossal. Can you open your mouth? Perfect. So tongue is midline. And can you move your side from side to side for me? Good. And can you say light, tight, dynamite? Perfect. So there's no tremors. Now I'm going to inspect and palpate your neck, okay? So skin color is consistent with genetic background. I don't see any scarring or lesions. Head position is midline and centered. Now I'm going to palpate. So there's no visible masses and no tenderness. Now I'm going to palpate the carotid arteries one by one, okay? Good. Good. So there's regular rhythm. Grade strength is a +2. They're equal bilaterally. Now I'm going to test for a cranial nerve number 11, spinal accessory, okay? So can you rotate your head while I apply pressure? Good. Other side. Good. And I'm going to get you to shrug your shoulders while I apply resistance, okay? Perfect. So now I'm going to check your upper extremities. So there's no lesions, no scarring, no deformities or swelling. Now I'm going to palpate your arms, okay? Temperature is normal and warm. There's no swelling or any tenderness. Did you feel any pain? No, okay? Perfect. And skin is hydrated with normal moisture. Now can you show me your nails? Good. So they're curved with no lesions. Now I'm going to test for your range of motion in your upper extremities, okay? So can you flex your fingers, extend your fingers, flex your wrists, extend your wrists, radial deviation, ulnar deviation, flex your elbows, extend your elbows, and supination, pronation, shrug your shoulders, abduct, adduct, and now internal rotation, external rotation. Do you feel any pain? So from what I can see, there is no pain, no crepitus, and no altered range of motion. Now I'm going to palpate your radial pulse at the same time for 1 minute, okay? Good. So the rate is 80 beats per minute. Rhythm is regular. Quality is strong. Grade strength is a +2. Equal bilaterally. And can you squeeze my 2 fingers? Good. So grip is strong and symmetrical bilaterally. Now I'm going to inspect your lower extremities, okay? So color is consistent with genetic background. Don't see any lesions, no scarring, and no deformities. Now I'm going to palpate, okay? Temperature is normal, warm. There's no swelling, no masses. Did you feel any pain while I palpate? No, no pain or tenderness. Good. Now I'm going to take your dorsal PDS pulse, okay? For 1 minute. Good. So rhythm is regular. Grade strength is a +1. It's faint, but it's palpable. Now for dorsal flexion, can you point your toes to the sky? And plantar flexion, so they're strong and equal bilaterally. I'm just going to remove my gloves, okay? And perform hand hygiene again. Good. Now I'm going to check your posture, okay? So I'm just going to get you to turn around, lift up your shirt. So I don't see any skeletal deformities. Symmetrical, there's no scarring, no lesions. Now I'm going to palpate, okay? Don't feel any masses, there's no lesions, no tenderness. Do you feel any pain? No? Okay. And there's symmetrical chest expansion as well. Now I'm going to auscultate, okay? Good. So breath sounds are normal, regular. There's no wheezing, no crackling. And then can you sit up for me? Good. So anterior posterior diameter is 1, transverse diameter is 2, making it a 1:2 ratio. Now I'm going to assess the anterior thorax, okay? So I'm going to watch for 1 minute. Good, so there's 14 breaths per minute. Breathing rhythm is regular. Quality of respiration is smooth, even, and effortless. Now I'm going to auscultate for your heart sounds, okay? So, second right intercostal space. Second left intercostal space. Third left intercostal space. Fifth left intercostal space. And left mid-clavicular, fifth intercostal space, the mitral valve. Since I'm at the mitral valve, I'm going to hold for 1 minute. Good. The rate is 80 beats per minute. Rhythm is regular. No extra heart sounds. S1 sounds are best heard at the apex of the heart, near the tricuspid and mitral valve. S2 sounds are best heard at the base of the heart, near the aortic valve. And now I'm just going to get you to lie down for me. And I'm just going to get you to lift up your gown, okay? So it's symmetrical. Umbilicus is midline. No visible masses, no lesions, no edema. Now I'm going to auscultate the 4 quadrants, okay? Okay. Good. So bowel sounds are hyperactive. I hear a gurgling sound, which is completely normal finding. I'm going to now palpate the 4 quadrants, okay? Please let me know if you feel any pain. So there's no pain, no superficial masses on all 4 quadrants. Now I'm going to palpate the bladder, okay? So there's no pain or discomfort, and it's not distended. Okay, so thank you for your cooperation. this concludes the head to toe assessment, okay? Thank you so much.